Low carb can make the scale fall faster on Wegovy or Zepbound, but the first drop may not be extra fat. A strict plan can also worsen nausea, constipation, weakness, or low blood sugar in the wrong person. The safest answer is not high carb versus low carb. It is whether the diet still supplies enough protein, fluid, fiber, and energy for daily activity. Wegovy contains semaglutide, and Zepbound contains Tirzepatide. Both reduce appetite and can slow stomach emptying. Cutting carbohydrates can shrink meals. The scale may fall faster, but eating and drinking can become difficult after starting or increasing the dose. Low carb is not one fixed diet. One person may replace bread and sweets with vegetables, fish, eggs, and beans. Another may eat almost no carbohydrate and rely on meat, cheese, cream, and added fat. Those plans can produce different side effects, even with the same medication. Before judging the scale, separate water loss from fat loss. Your body stores carbohydrate as glycogen, stored glucose. Glycogen holds water. When carbohydrate intake falls sharply, glycogen and its attached water fall too. Several pounds may disappear quickly, but much of that loss is water, not body fat. Fat loss still requires eating fewer calories than your body uses over time. Low carb can help create that gap by removing sugary drinks, desserts, chips, and large starch portions. However, Wegovy or Zepbound already lowers hunger. Severe restriction may add little benefit when the medication has already reduced portions enough. A moderate low-carb plan can help. Protein and vegetables may replace foods that were easy to overeat. Blood sugar after meals may rise less, and fewer cravings may make the plan easier to follow. The benefit comes from the food replacement and lower calorie intake, not from carbohydrate avoidance alone. Now compare two people. The first removes soda, pastries, and oversized rice portions while keeping protein, vegetables, fruit, and water. The second removes nearly every carbohydrate, then eats fatty meats and cheese despite nausea. Both are low carb, but only one has built a plan that supports treatment. This difference matters because these drugs can cause stomach and bowel symptoms. Nausea, vomiting, diarrhea, constipation, acid reflux, and abdominal discomfort are common. Low carb does not cause them automatically. A poorly designed low-carb diet can amplify them through heavy fat intake, low fiber, dehydration, or meals that are too large. High-fat meals are a hidden problem. Fat digests slowly, and these drugs may slow stomach emptying further. Bacon, cream sauces, fried meat, cheese-heavy meals, and large servings of nuts can sit badly. A meal can contain almost no carbohydrate and still trigger fullness, belching, acid reflux, or vomiting. Constipation develops through a different pathway. People often remove cereal, fruit, beans, and whole grains, then fail to replace their fiber. Lower appetite reduces food and fluid intake. The bowel receives less bulk and less water. The result may be hard stools, straining, and days without a bowel movement. A fast scale drop can hide a worse treatment plan. Water loss looks impressive, and eating almost nothing looks disciplined. Neither proves better fat loss. When protein, fluid, and overall food intake fall too low, muscle and strength may decline. Side effects become harder to tolerate. Muscle loss matters because weight loss is not only about the number on the scale. Older adults are vulnerable to weakness, slower walking, and reduced balance. A strict diet that makes protein unappealing can worsen that risk. The goal is to reduce body fat while protecting strength and daily function. Protein should therefore anchor each meal. Eggs, fish, chicken, Greek yogurt, cottage cheese, tofu, beans, or lean meat are options. The amount depends on body size, kidney health, age, and activity. The test is simple. Can you eat a full serving of protein 2 or 3 times daily without worsening symptoms? Drinking enough is the next priority. Nausea can reduce drinking before thirst becomes obvious. Vomiting or diarrhea can accelerate fluid loss. Dark urine, dizziness when standing, a racing heartbeat, or very little urine suggest dehydration. Fluid loss can stress the kidneys after a dose increase. Low blood sugar requires a separate check. The risk is low without insulin or pills that force insulin release. It rises when carbohydrate intake drops sharply, while insulin or those pills stay at the same dose. This is a medication issue, not proof that low carb is working. Those pills are sulfonylureas. They push the pancreas to release insulin. Examples are glipizide, glimepiride, and gliburide. Shaking, sweating, confusion, weakness, or sudden hunger can signal low blood sugar. People using insulin or these pills may need glucose monitoring and dose changes before sharply cutting carbohydrates. Medication safety is one part of the decision. The right carbohydrate level should allow enough protein and fluid, regular bowel movements, and energy for daily activity. A plan that fails those tests is not working, even when the scale drops quickly. Use 4 checks to judge the plan. You can still eat protein at each meal, and urine stays light yellow. Bowel movements stay manageable. Normal daily activity continues without dizziness or unusual weakness. Trouble in any one area identifies a problem earlier than weekly weight alone. The best version is often lower carb, rather than nearly carb-free. Keep vegetables, small portions of fruit, beans if tolerated, and modest servings of potatoes, oats, or brown rice. Remove liquid sugar and oversized portions of white bread, rice, or pasta first. This approach reduces carbohydrate without sacrificing every source of fiber and energy for daily activity. Timing also changes the answer. The week after starting or increasing Wegovy or Zepbound is not the ideal time for an aggressive diet experiment. Appetite and stomach symptoms may already be changing. Keep meals simple, smaller, and lower in fat, then judge carbohydrate reduction after you know how the dose affects you. When nausea is active, choose foods that are easier to tolerate rather than chasing perfect carbohydrate numbers. Small servings of yogurt, eggs, soup, fish, toast, fruit, or rice may work better than a very high-fat meal. Temporary flexibility can protect hydration and protein without destroying long-term progress. When constipation is the main issue, do not simply add a huge fiber load overnight. Increase fluid first, then add tolerated fiber gradually through vegetables, berries, beans, chia, or whole grains. Sudden large amounts can worsen bloating when stomach and bowel movement are already slow. Some symptoms go beyond diet adjustment. Severe or persistent vomiting, inability to keep fluids down, fainting, very little urine, confusion, or severe abdominal pain need medical attention. Do not treat those signs as proof that the diet is working. They can signal dehydration, kidney stress, gallbladder trouble, inflammation of the pancreas, or another problem that needs checking. Without those warning signs, judge results over several weeks, not several dramatic mornings. Track waist change, strength, energy, bowel function, glucose readings when relevant, and the ability to continue the plan. Faster loss is not better when strength, energy, or bowel function steadily worsen, nor is it better when the diet cannot last. Low carb can work with Wegovy or Zepbound, but stricter is not automatically faster or safer. The strongest plan removes excess calories without sacrificing protein, fluid, or fiber. It also addresses low blood sugar risk with insulin or insulin-releasing pills. Choose the lowest carbohydrate level that remains nutritious, tolerable, and sustainable, not the lowest number you can survive. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.